good morning to each and everyone present here. I thank the organizers for giving me this opportunity to speak on the topic next. Yes, so I'm going to speak very briefly about strengthening health information system, the key to implementing universal health coverage in India. So universal health coverage is something which is very commonly known, and the speakers before also have touched upon, Dr. Supten sir had just touched upon that, and how the government of India is very keen on implementing that with the help of the digital health mission. So I'm going to briefly start with, this would be my talking points. Please don't mistake it. It's not so exhaustive as it looks like, but then I'm just going to be briefly touching on all these topics. So how actually the UHC came about? Even though the UHC, the universal health coverage, was mandated by the WHO in the year 2010, eventually in the year 2013, we moved from the Millennium Development Goals to the Sustainable Development Goals. And the Sustainable Development Goal 3 actually talks about the Agenda 2030 Agenda calls for better action for health. So to achieve universal health coverage, which includes financial risk protection, access to quality essential healthcare service, access to safe, effective, quality and affordable medicines and vaccines for all. So this is very important in the UHC perspective. And then we have the core dimensions of UHC, which talks about the proportion of a population, the range of healthcare service, and extent of the financial risk protection. Now, in this, the universal health coverage talks about amongst the population, who is the population which is going to be covered, what is the extent of the services, and how much would be the out-of-pocket expenditure which the person will have to pay. So this, all these three are the key points of the universal health coverage. And then as the National Health Policy 2017, which again the previous speaker had touched upon, we have a wide range of around 9 areas, and I have highlighted few areas wherein the importance of us as health information professionals are very important. Organization of healthcare services, access to technologies, developing human resources, building knowledge base, developing better financial protection strategies, and strengthening regulation and health assurance. So as per the NHP 2017, the objective of integrated health information system would necessitate both private sector and the public sector in participating into developing some common network, as I mentioned, wherein both the public and the private providers would be involved. And it also talks about metadata and data standards and electronic health records. So finally, we need to have a seamless health information system in place, and we also would have creation of registries documenting diseases and health events. And the UHC, the universal health coverage, or the Ayushman Bharat, which the government of India is planning to keep, it will focus on health maintenance, especially the outpatient maintenance, which is not covered in the general health insurance policies, gatekeeping and reducing the pressure on tertiary care centers, geographical coverage by region wise, and overall improving the general health system. And finally, it's going to rely on the concepts of primary care. So when we strengthen the primary care, we will not have pressure on the tertiary care system. So how this efficient use of health information system? So in developing countries, we always, especially in a country like India, we always have struggled with insufficient information, gaps in clinical health information, and technology for health financing. So when we had all these kind of lacunae, probably we need to modernize the healthcare financing system. And since there's a general misunderstanding that informatics and finance doesn't go hand in hand, but it's my opinion, and it's also, we have seen countries in the neighborhood, countries like Thailand, Vietnam and all, which has taken this forward, and they have trying to modernize the health finance environment. So what are the issues we need to be addressed in terms of health information management with regards to UHC? We have large-scale inequalities and disaggregation of indicators, and that should be made more widely available. So data should be made more widely available, which is not happening as of now. And we have challenges, we do not have health financing system wherein we can adequately mobilize the funds. So we need to have a health insurance information system, and we must, think about exchanging the data in order to facilitate the core functions of various health financing schemes. So this is very important, and the key components will be, we need to have a payer information system, and we need to have a bridge between the payer information system and the provider information system, and it should be an interoperable system. So first of all, a payer information system, which is the core business. This is as proposed by WHO, wherein the core business model includes enrollment, rostering of beneficiaries, collection, management, premiums, all that is involved in the insurance business. And there has to be a bridge between the payer systems and the providers, so that the business processes can be transacted electronically. And then systems at the providers, that's the clinical information systems, and standards of interoperability. So that just now sir was mentioning about the common coding system. So when with Snowbend CT and ICD-11, probably the systems can talk to each other, and it can lead to a better implementation of the UHC. Since we are in the process of implementing UHC, we need to have a very strong NHIS, and that need not be mutually exclusive also. So UHC implementation in India, we have the political and financial impetus for it, and this is gearing to improve the accessibility, quality and efficiency of UHC. So automation is here to stay, and automation will reduce cost and errors and claims processing time. And as I mentioned, interoperability between healthcare providers and regulators should be there, like the IRDA, which already has been regulating the healthcare industry, should also regulate the National Health Insurance Information System. So essentially, we need to have standards and interfaces, communicating seamlessly and securing claims, routing hubs and registries, which is here to stay. So this should look like something like this, wherein information exchange within the national health system, wherein we have the Ministry of Health, health facilities, beneficiaries and health insurance as the stakeholders, and we may have information types and data volume ranging from medium to high to low, but depends on what kind of information flow. This can be a reasonable structure. And to look in the past, we have examples from the evidence states that we have examples from Netherlands, which had a national health insurance information system, and 90% of their claims data produced, they could process electronically. France also was one of the countries which they launched a national health insurance regime, and they were very successful in and sustaining it. We have something called as the Swiss Tropical Management Institute. They have an open source platform, and this open source platform provides flexible solutions for a cost-effective implementation model. And many countries like Nepal, Tanzania, Congo, Chad, I'm mentioning these countries because these all countries, as we all know, are within the group of the developing countries, and when they have been able to do it, probably we should also be taking it up. And we have the National Informatics Center, which already has a digital district health information system currently being implemented. Probably they can take up these challenges, involve all the stakeholders, involve the health information management professionals, insurance companies, TPAs, and public health agencies, and national implementation agencies to be involved to streamline the whole system. And primarily this will help in detecting fraud in case of insurance reimbursement, and also bringing in accountability of sorts to the entire process of healthcare financing environment. So in conclusion, as a developing nation, we are one of the most populous nations, and SDG Goal 3 is quite dependent, the outcome of SDG 3 is quite dependent on a very populous country like India. So we need to have these information systems in place where we need to drive the UHC, and it should have a user requirement approach than only a data-led approach. We largely, by and large, we are had had systems wherein they were looking at a data-led approach, but we also need to take the user requirement into consideration when we have systems like this. And when we are moving towards implementation of UHC, NIH also should happen simultaneously. It should go hand in hand, and that creates a lot of opportunities for the health information management profession, for the health informatics area, and finally it is effectively going to help the UHC take forward, and by the end we should be able to have a healthcare for all, because the UHC says that we need to have a health coverage for all, and this is a brief presentation of how an NHIS would lead to a better implementation of UHC. Thank you.
Can you tell me something about the origin of this agenda?
So the SDG.
Do you have any idea about that, please? Just
yes, sir. Sir, the Sustainable Development Goal was 2030 Agenda was set up. Was envisaged by the WHO in the year 2012. They were having the Millennium Development Goals, and they moved to the Sustainable Development Goals in the year 2012, and that was mandated in the Rio de Janeiro meet of the WHO, and they had a World Health Assembly. So 2030 is the agenda they have put forward to have a universal health coverage. And if you see, sir, universal call for action for better health. So health becomes a part of that SDG 3, Goal 3. We have ending poverty, ensuring that all peace, prosperity, everything is there. But apart from that, health for all is something which was key to that agenda.
There's the language I expect. Health for all.
Yes, sir.
WHO.
Yes, sir.
Declaration of health for all.
Health for all.
At held at Alma Mater, USSR. Then undivided Russia.
That was, yes, way back in Alma Mater.
September 1978.
Yes, sir. So they have.
That would have been added in your talk.
Yes, sir. So why
just for information,
yes, sir.
not to discourage you.
No.
You can exhibit that also.
Yeah.
So that was the beginning origin. Primary health for all,
yes.
Universally.
Primary health for all.
By the WHO.
Yes. But in the year 2012, they made it to Sustainable Development Goals, which also spoke about the health for all, and that is the Agenda 3. And as India, as I mentioned, is one of the most populous nations, so to achieve that Agenda 3 of SDG, they feel that India should come forward and go for a UHC.
Thank you.
Thank you for your question. Anybody? Any from the audience?
Thank you very much for your presentation. I have two questions. So
yes.
When exactly will there will be in India a centralized health information exchange that cover the entire country? And what kind of technology are you going to be using for this?
Sir, probably I will not be able to answer much about it, but then because the government of India is planning to go for the universal health coverage, that is with the Ayushman Bharat. So when we have to have a UHC implementation, we also need to have an NHIS in place. So as the previous speaker, Dr. Suptain, was mentioning about the National Digital Health Mission, so it is on the process. So it is not exactly in place, and probably we do not have a National Health Information System in place currently. We might have it in future.
One input I am giving to you. The government of India has already been announced that is a health stack by Niti Aayog. Okay,
yes,
so if we can go through it,
yes,
so it is clearly mentioned.
Yes.
After that, it has come as the National Digital Health Blueprint.
Yes.
Because the data will be stored centrally in one place. So there is a health information exchange usually come up. So all this is in the plan, but yet it has not been implemented.
Thank you, sir.
Any questions? Okay. Thank you, Rashmi.
Thank you, sir.
So, next talk.